Imagine you are in a busy clinic or a rural health center. A 10-year-old patient walks in with severe sore throat, fever, and swollen tonsils. Should you immediately prescribe antibiotics to be safe or wait? Let's use the modified Centor Score to find out. Just clinical decision rule for streptococcal pharyngitis. A modified Centor Score is a clinical prediction tool used to estimate the probability of group A beta hemolytic streptococcus in patients presenting with sore throat. The primary goal is to promote antimicrobial stewardship by avoiding unnecessary antibiotic prescription for viral pharyngitis. It is validated in patients 3 years of age and older with acute pharyngitis. That means symptoms less or equal to 3 days. The modified Centor Score, also known as the Misak score, improves upon the original Centor Score by factoring in the patient's age to account for differentiating rates of strep throat prevalence across different age groups. Both tools evaluate the likelihood of group A streptococcal pharyngitis. Centor Score is used for those older than 15 years, 1-5, whereas modified Centor Score, it includes age, so it is used for more than 3 years. Centor Score has 4 criteria, whereas modified Centor Score has 5 criteria. So the 5 components of the modified Centor Score include temperature, exudate, adenopathy, cough, and age. Each present finding gives 1 point. Temperature greater than 38 degrees Celsius, tonsillar exudate or swelling, tender anterior cervical lymphadenopathy, absence of cough, and adjusted points based on age group. The age adjustment is for those age 3 to 14, 1, 50 to 44, 0, 45 and above, -1. Group A streptococcal pharyngitis or gas pharyngitis is rare in children under 3 years old. Score calculation and interpretation include the score ranges from -1 to 5. Score 0 to 1 is very low probability, 5 to 10%. Score 2 is intermediate probability, approximately 10 to 70%. Score 3 has moderate to high probability, between 28 to 35%. And score 4 or 5 is high probability, above 50%. To be group A streptococcal pharyngitis. Clinical management by score include, for those score 0 to 1, no antibiotics or throat culture recommended. For 2 to 3, just obtain a rapid antigen detection test or throat culture. Treat with antibiotics only if the test is positive. For 4 to 5, strong suspicion for group A streptococcus, can treat empirically or confirm with RDT before treatment, but you can treat it empirically if it is 4 or 5. The original Centor Score did not account for age. By adding the age modification, the modified Centor Score, the tool accurately reflects the fact that children are more frequently infected with group A beta hemolytic streptococcus than older adults. Differential diagnosis or mimics of strep throat include, just if the score is low, consider other etiologies such as acute infectious mononucleosis, acute retroviral infection, viral upper respiratory infection such as common cold, and gonococcal pharyngitis. Treatment options for positive group A streptococcal pharyngitis include penicillin or amoxicillin for 10 days. If the patient is having penicillin allergy, you can use first generation cephalosporin such as cephalexin, macrolides such as azithromycin or clindamycin. The goal is just to reduce symptom duration, prevent suppurative complications such as peritonsillar abscess, and prevent rheumatic fever. Clinical scores are most useful for safely ruling out group A streptococcus rather than confirming it based on symptoms alone. So always confirm with diagnostic tests such as rapid antigen detection test or culture when appropriate to avoid unnecessary antibiotic resistance. Thank you for watching.